waziri wetu wa afya na pia gavana wetu.
We are now proceeding to the witnessing of the same. On our side of the county government, we will have our county secretary and head of public service. On the side of SHA, we will have the CEO of SHA, Dr. Masima. We are now proceeding to the signing.
The CS in charge of Ministry of Health, the PS, the leader or the MD for SHA, and all protocols observed. I want, first of all, to take this opportunity on behalf of people of Vihiga County and on behalf of the Vihiga Government Executive Committee to most sincerely thank the Ministry of Health for the support they have continued to give to this government, and particularly the cooperation we have had. And today, we have witnessed the signing of a memorandum of understanding between the government of Vihiga County and the Ministry of Health, where we have committed to work together to support each other to ensure that we achieve the ultimate aim of having universal health coverage in this county and in the country. I want to thank the CS for coming for this occasion. I also want to thank the SHA leadership, because for the last 2 months, we have worked together to ensure that we have an agreement which will allow our staff for the first time to access to medical insurance coverage for all of us in this county. We have gone through a rigorous process, but we have been able now to come to an agreement, and we have signed this agreement today, this afternoon. This agreement allows our staff now to access to medical services in various hospitals under various agreements that we have signed, which we shall be explaining to you later so that you all know what is in that agreement. And therefore, I want to thank all of you for the patience. I know the leadership, particularly the workers' leadership, the unions, you have been on my neck for many years. But finally, I have managed now to achieve what I promised you. So I want to assure you that it's going to work well. Finally, before I call in the CS to give his remarks, I want to make a few comments about SHA. A lot has been said about SHA, negative and positive. But I want to say the following. SHA is an innovative system that has been well thought out, and it is being implemented in a manner that in the long run, if all parameters are kept constant, it will be one of the best programs that this country would have achieved. Right now, we have a lot of challenges and a lot of teething problems, but this is expected anytime you start a new system, a new way of doing things, you will always meet challenges. So SHA is not an exception. We have challenges, but these challenges are being addressed in a very pragmatic manner. And it's a question of time and things will work. So I want to thank CS, the ministry, and the government and the president for bringing up this program. This program will transform the healthcare sector and will lead to the achievement of universal health coverage. And therefore, I would want to appeal to my people in Vihiga to register in large numbers. And now we shall be launching the digital registration, where registration is going to be done in every health facility. And we are thankful, the CS, you are giving us the equipment that will allow us to register all our people at the health facility. This will allow everybody to get on SHA program. And therefore, let us have the patience, and this program is going to work. For the short time we have had SHA in this county, CS, I can tell you we have seen quite a lot of changes, particularly in our health facilities, level 2 and level 3. For the first time, some of our facilities have received money that they had never received at all since we built them. We have, for example, one health facility called Likindu, which has been able to receive quite a lot of money. In fact, they have received more than 4 million shillings. Yeah, about that. Until the management of that facility became so excited that now they have done so many improvement of the facility. They are even now, in fact, in process of building new wards, maternal wards. So it is important that if this program is well executed, the health facilities in the long run will have money to run themselves, and they will ensure that all the activities are done. So once more again, I want to thank the ministry, thank the president for the program, and appeal to all of us to join this program. With those many remarks, let me now take this. Karibu sana, welcome.
Mheshimiwa Gavana wa Jimbo la Vihiga, my old friend, colleague for many years, and one of the most progressive leaders we have in Kenya. Last time when I came here, I was the Minister for Environment and Forestry. And I went to Maragori Hills to plant trees. Na nilikuwa na deni ya hii Vihiga. There was something very important I was supposed to do for the people of Vihiga. And that was to grant the people who live in Shaviringa their title, the Gazette de Forest, because this building you are seeing here is where they lived 50 years ago. And when the governor and the PCS brought to my attention, I want to confirm and report that before I left the Ministry of Environment, I passed that at the cabinet. It's now in Parliament, and it's at the good hands of my colleague, Dr. Deborah, and the people of Vihiga. As I promised, I will come back here with the president to issue title deeds. Because whatever we commit, we must do. So I am speaking for my colleague, the Minister for Environment. So it was one agenda. Now today we are in Vihiga. We had a very good, candid, progressive discussion with the governor and the leadership of Vihiga County and also the health sector leaders. We have looked at the numbers, we have shared the challenges, not only on SHA, but the whole healthcare indicators, from maternal mortality rate to neonatal, to all that. We must make sure as the Ministry of Health, working with the county government of Vihiga, that the health of our people is right. A lot of people, they talk about SHA before they understand the whole architecture of this social health authority. They go to TV, they go to newspapers, they go to funerals, but they go when they don't have the information. Even this morning when I was coming, I was watching Citizen TV. It was a very good debate, but the majority of the people there have not understood. SHA is in three forms, and let me make it very clear. First, as of today, over 26 million Kenyans have registered as members of the Social Health Authority. Here in Vihiga County, over 250,000 have registered as members of the Social Health Authority, translating to 42% of the entire population. So we still have about 500,000 plus citizens of Vihiga who have not registered as members of SHA. And we have asked our community health promoters, our county health workers, under the leadership of our governor, our county commissioner, with all our DCCs and chiefs, to make sure more Kenyans in this county register. And why should they register? SHA is in three forms, different from NHIF. There is a primary health care funded by the government of Kenya, led by President William Ruto, through Parliament. And this year alone, we have 13 billion in the budget. And what is primary health care? Level 2, level 3, and level 4. Dispensary, health center, sub-county hospital. Any Kenyan, and let me repeat, any Kenyan who access outpatient services in level 2, level 3, and level 4 sub-county hospital, they will be treated free of charge. And the government of Kenya, through SHA, will pay the governor and the government of Vihiga. All you need to do is for you to register. And I've asked the governor and the CEC and the leadership that in every of our dispensaries and health centers and sub-county, let us put at the gate a SHA desk. That even those Kenyans who have forgotten to register, let them register. You don't need to pay, you just need to register to access outpatient care. That is one section of SHA. It never used to be there during NHIF. NHIF was a club. If you are salaried, you are a member of NHIF. But this primary health care is free for all citizens. So these 26 million Kenyans, majority of them are accessing free primary health care. Then we have the Social Health Insurance Fund. When you require specialized treatment, you require dialysis, you require to go to the theater, you want our mothers to deliver in safe, secure hospital, normal delivery, C-section, all those specialized treatment, then you go to Social Health Insurance Fund. You pay according to your income. And I am very happy, Governor Ochichilo, you are the first governor, a very progressive governor, who has the heart to think about the health of his over 3,000 workers. And I'm sure today many other governors will follow suit. Then we have the emergency, chronic, critical illness fund. I am doing all this to educate those who go to TV. You know, they must understand this thing. Kama kitu hujaelewa, utakuwa na shida. Emergency, chronic, critical illness fund. For example, a Kenyan gets an asthma or a heart attack or get an accident in any of our towns and villages. He will go to a hospital, whether he's registered with SHA or not, the government of Kenya will treat him free of charge and SHA will pay. And that is found in the Constitution. We are complying with the Constitution. Na katika primary health care, hapa Vihiga, the highest amount of money, 80 million, imeenda kwa zile hospitali ya county. Out of the 107 million we have paid, 80 million went to the county government hospitals. The balance went to the faith-based and went to the private hospitals. For healthcare to succeed, the patient is number one. The health facility is not important. It's important, but the doctor, the minister, the governor, the most important person is the patient. And the care of the patient we give to. Wale mahospitali walikuwa wanapora. Na tumerudia mimi na rais. Wale walikuwa wanapora pesa ya umma. Anasema mama amejifungua hospitali, he doesn't give us. You're a nurse, am I right? There's something called birth notification. Am I right? A very important document. If you say in your hospital 20 mothers have delivered and there's no birth notification as part of your invoice, we will not only pay you, we will arrest you. Kwa sababu for mtoto kuhakikisha mtoto amezaliwa hiyo hospitali, hiyo document mimi sijasema inas. Hiyo document ni muhimu. Ukisema mama amefanyiwa C-section na mtoto ametolewa, uniambie, so there must be theater notes. There must be theater notes. So to me we say, is a medics, mimi si daktari. Is a doctor sitting here, even some from my headquarters. Daktari is here, and he was a medical officer here in Vihiga. After Oluga, my doctor came now, he works with me in headquarters. Say, daktari, there must be theater notes. Without theater notes, how do we know a cesarean procedure was undertaken? Sasa wakora wanatuambia sisi tulipe tu, hatuwezi kulipa. Na iko hospitali tumefunga hapa Vihiga. Si mnajua? There's a hospital I have closed here. The biggest crime that hospital, na kama wenyewe wako hapa wanisikize. The biggest crime that hospital was committing is they were giving us ghost patients. Not real patients, ghost patients. Unaona mtu ana turn outpatient, umeenda hospitali, umetibiwa, umeenda nyumbani. He has turned you into an inpatient. Atumelala ya hospitali siku 10. Na wewe hujui. No. You know the data we have, the information we have, those guys who go to TV don't have. And I want to tell the country on this matter of cleaning the health sector and bringing reforms. The people who brought down NHIF, you better look for another business. It's not available. SHA is not available. As long as the doctors in our country are very happy. I have solved all the disputes in the health sector. Madaktari mnaona sikizi wanasifu waziri ama wasifu kina David. Madaktari? Yes, come. You are from KPMG. Yeah, you come here. This is a representative of the doctors. I'm not saying. We are now friends. We are friends. Because all the doctors were raising from their CBA to internship, we have resolved. UHC, my peers is here. And there was a nurse who sent me a text. Ananiambia niangoje hapa Vihiga leo. Ako wapi? Na nikamwambia niangoje. UHC mwezi hii September, he is paying them the salary of permanent and pensionable. Na mdosi wangu amesema they must be given letters of permanent and pensionable. So tutawapatia. Madaktari wamefurahi, all cadres. Raia wamefurahi. Wananchi wamefurahi. Wale hawajafurahi ni makatels. Na muliona files zao zingine nusu 80 files nimepatia. Unajua mimi si askari. Nimepatia DCI na nimepatia IG. Hata hapa simefunga moja hapa. Vihiga was lucky. So cartels, you can go everywhere. Wengine wanataka kusimama 2027 na ni madaktari. Sasa wanataka kutumia TV na SHA kupata bonga point. I am telling them SHA will not gain you. Ana mnawajua. Yuko mmoja hapa juu alisimama Kakamega, senator. Akashindwa na Boni Khalwale. Alilimwa na bullfighter. Sasa badala ya kuja Kakamega kutafuta kura, yeye ni TV tu SHA. Tutafautishe SHA na NHIF. NHIF tuko na bill ya 30 billion. Lakini tumesema we must verify those bills. Kwa sababu mimi sina pesa yangu binafsi, rais hana pesa yake binafsi, ile pesa tuko naye ni ya wananchi. Na lazima tuhakikishe the bill we are paying is the right bill. So tumemwambia wakuje to verify. Wakaenda kotini. Mimi naambia sawa, mkimandana na kotini mkuje. And now I'm saying anybody who wants me to verify, county government, private, my doors are open. Kuja na documents zako. Tukikuuliza theater notes ulete. Tukikuuliza birth notification na kuna kubackdate. Tuko na forensic auditors. Usijaribu kujaza hii system, ukijaribu kwenda hivi inakupata hivi. If they confirm that the 30 billion is verified, we as a government will pay. But you must go through verification. So don't mix SHA na NHIF. This great lady is not and has never worked. Dr. Mercy. Dr. Mercy has never worked for NHIF. She has never been the CEO. She is the CEO of SHA. So hata ukimuuliza mambo ya NHIF, uliza mimi na Oluga. Sisi ndio, si alikuwa daktari yenu hapo. Na hiyo pesa yake areas usilipe. Kwa sababu watu wa Vihiga wamemuombea mpaka amekuwa PS. Sasa unajua Oluga mahali umefika, usitafute pesa kidogo. Vihiga nimewafanyia 2 years mkaniombea. Leo mimi ni PS. Mpaka leo nitakana uache pesa hapo. Gavana usilipe yoyote, faili yake close. Na kama unamdai arrears, leta mimi tayari tunalipa pamoja. Ni mti yangu ya mkono. So good people, you have seen our progressive governor. He hospitali, he has put whatever was required for it to be taken to level 5. I assured you, Governor, Kenya Medical Practitioners and Dentists Council, the regulator led by Dr. Kiriuki, they will come, they will inspect. In 2 months' time, we will give you the license for it to be level 5. When it becomes level 5, there will be more facilities. When it becomes level 5, you'll get all the chief money, starting with your own staff. They are very good faith-based hospitals. They are very good private facilities, but they are very bad cartel-led facilities. Ukiona hospitali iko chini ya uko nyuma ya bar, anakuambia ati yako na theater, anafanya operation, anatuambia kwa mwezi anafanya operation nyingi kushinda Kenyatta Hospital. Kenyatta Hospital iko na 25 theaters, lakini yeye anakuambia ati anashinda. Ndio wale wanasema will impeach Duale. Mimi na Ochechilo sasa tumekuwa wazee. Sisi tumekuwa wabunge, hiyo bunge tumekaa. Mimi akaniwacha huko nikakuwa leader. Yeye akakuwa watu wa Vihiga wazuri mkachagua mara mbili. We want to leave a legacy for Kenya and for our people. Me and Ochechilo and the president. Health is not something we can play around with. The lives of our people, we cannot gamble. Now here, universal health care, Taifa Care, was started by President Kibaki. Cartels wakasumbua. President Uhuru akaanzisha. Pilot Kisumu, Nyeri, Isiolo, Machakos. Akaona cartels, akatoroka. Sisi tuko hili sasa. Hasala amesema atoroki. Na mimi nimekuja hapo sasa. Nilikuwa mnafukuza mawaziri wengine. Mimi sasa nimefika. Mimi sitoki. Madaktari niko naye. Wananchi wako na mimi. Oluga ambaye alikuwa trade union ya madaktari ako na mimi. Sasa iko shida gani? Si tutibu wa Kenya. Si mmekubali tupigane na cartels. We want every Kenyan patient to get quality care and dignified care. Ya mwisho, Governor, this is a county that has shown us that, of course, I agree with the governor, we have transitional challenges. Sasa tumeleta biometric. Ilikuwa OTP, sasa tumeleta nini? Biometric. Ukiweka hiyo kidole yako, ID card yako yote inatoka. Na huwezi kupana mtu mwingine. Zamani NHIF card ulikuwa unapatia watu wengine waende watafuta. Sasa hii utakata. Sasa hii. When we close OTP today? Yeah, leo tunafunga kitu cha OTP. Level 4 to 5, 6. Kidole. Mtu na hospitali yake anatuambia ati wamama 300 wamekuja na wote walikuwa hawajafanya normal delivery. They went through cesarean. Is that possible? Even it's against WHO. Am I right? Yeah. Here to ni wizi, you know, daylight robbery. No, you can do wizi maningine but not in the health sector. So what you are hapa tafadhali. Ya mwisho, governor na county commissioner. Primary health care, dispensary, health center, sub-county hospital, outpatient is free. Ule atafanya co-charging is committing a criminal offense chargeable in a court of law. Hata usiambiwe nunua kitabu, exercise book. Mesikia watu commissioner? My chief, na kila mtu. We want all the own source of revenue of Vihiga County health sector to be the highest. And it's going to be. We have given him all the information when we were there. He has agreed, our numbers have agreed. He's agreed with our systems. Zile izuka ya kulipa tayari kuanzia leo, kwanza leo analipa SHA, kesho, public servants. The whole of this week will be paying. Wednesday tuko Nyandarua. Sisi kazi yetu ni kuelimisha wananchi na kupatia Kenyans universal health coverage. Asanteni sana. Mungu awabariki.
Congratulating the governor and thanking our cabinet secretary for being here today on this show of leadership for the welfare of workers, because health benefits is part and parcel of what we have as in the Employment Act, in the Workers' Injury Benefits Act, it is there in the Labor Relations Act, it is there in the Industrial Charter, and it is there in the Public Service Act, so that we make sure that all the workers, first and foremost, are taken care of. And Waziri and Excellency Governor, we want to thank you. As you all know, I came from this background, so it's very important that we acknowledge that the workers must be as well as the healthcare system that we want to build. Waziri, mine is kidogo. I know this county very well. I've been around here. I used to work in this hospital for 2.5 years. Between 2012 until August of 2014 when I left, I was here. I was a medical officer in charge of the internal medicine wards. I used to see all our patients for HIV. I also used to carry a briefcase and do cardiology services with ECG. So, and Waziri, I used to stay there. I used to stay in the staff quarters. So this morning, our staff went there to see where I used to stay. And it's also a motivation for most of the workers here that you can be anything, you know, and then to just show that what is important for you is to wake up every day and do what is required of you. And Waziri, I wanted to complain to you because up to recently, I was still paying rent for that house. I wrote a lot of letters here that it should be stopped, but earlier I met the county secretary, who is now very dedicated, and I think that issue has been sorted out. You know, I wanted some refunds for the rent I've been paying for that house, but the county secretary has taken that. I was also in the hospital. Excellency Governor, I want to thank you for the work that you've done in the hospital. Waziri, I can attest to you that this county has implemented the one bed, one patient rule. I went there, Excellency Governor, you'll forgive me because you know I know this county, so I just sneaked around and I toured some of the facilities. I saw the good work that is happening. I spoke with some of our workers, most of whom are my colleagues, most of the doctors and nurses here, people I worked with, the theater in charge, bunnies, they were still there when I was there. So, and I was mentioning to them only one thing, that we must improve the interaction between the patient and the doctor, because that is what Wananchi interpret as UHC. What we have done today is good. What we are doing in terms of rollout of UHC, the universal health coverage, the enrollment into SHA, Waziri and the president are already championing that very well. Every day we have a lot of Kenyans joining. What we have to do at our level with the CEO of hospitals and with the chief officers and the CECs is to make sure that these benefits that are being announced today, the benefits, when we say that we are paying 550,000 for cancer, we must make sure that the hospitals are able to provide that service. And Waziri, that is what I'm helping you to do with all the facilities in this country. And I'm very keen to engage with chief officers, to engage with CCs, to engage with in charges of facilities, so that the health system performs, so that when we tell people that the Social Health Authority will pay 180,000 for a knee surgery, that you go to that facility and indeed you find a knee surgery, that you can be helped. And that is what I am taking very seriously with the workers, and also taking very seriously with the in-charges. And that is the work I was doing, Excellency Governor, this morning, to ensure that we engage so that we achieve clinical excellence, clinical governance. We make sure that the services are safe. We make sure that those services have what we call clinical effectiveness, or good outcomes, that people get the help that they came for in the hospitals. Without much ado, CS, allow me to welcome the governor, whom we are in his county, to make his remarks, and then welcome you. Oh, yes, the CC is here. Thank you.
Starting with 1.5 million Kenyans households who are indigent, who are people living with a disability, and who are under the category of orphans and vulnerable community. That translates to about 4 million Kenyans. Our governors have committed to pay for a number of indigents. Our members of parliament are paying for indigents. Edu Afia will be part of that. And we want to make sure the structure and the architecture of universal health care is to make sure no Kenyan is left behind. No Kenyan is denied access to health because of his financial inability. And that's why the Social Health Insurance Fund contribution is pegged on the income of a person. What I pay, what the governor pays, is not what some of his staffs are paying. So we are paying more to cover for the people. Today, when Kenyans go through mean testing, there are Kenyans who pay 300. There are Kenyans who pay 500. There are Kenyans who pay 400. There are Kenyans who pay 800. The indigents that the governor is going to pay for, and the president in our social health protection database will pay 660. African countries are coming to learn this system. And we are going to insulate this system, this universal health coverage, from the vagrants of cartels. So mimi sina kazi zingine, madaktari wako sawa, Wakenya wako na mimi, bunge wako na mimi, wale watu wako na mimi ni wakora, na mimi wakora nikishikana na polisi and other security agents, tutadili nao the way we deal with other wakoras. Si kazi ya polisi ni asubuhi mpaka jioni ni kutafuta mkora. Si ndio? Sasa they will be part of police now. They have another category. So I've answered any other question.
It is a very exciting day because Vihiga County is the first county in Kenya that has been able to enroll the county government employees into the Public Officers Medical Fund Scheme at SHA. And we need to clap for Vihiga County. We need to celebrate the leadership of the Governor, Otichilo, for being the front runner, for seeing it useful and wise to ensure his county employees are covered with this cover that will be enhanced and that will protect them and their families. Now, one of the things that also has been monumental in the last few days is that we've received 4 billion Kenya shillings from the Ministry of Public Service, and we now have the resources available to be able to pay out claims for the Public Officers Medical Fund Scheme. We are processing claims between today, Monday, and Wednesday, and so facilities and providers should be ready and expectant of payment of their claims. Now, as we do this, we also do have funds available, and particularly for Vihiga County, that has a high burden of teenage pregnancies. We would want our community health promoters, our nurses at the ANC service, our facility in charges to really put effort in ensuring that our teenage mothers are registered. Once they come into the facility or the antenatal care center, they'll be registered, and SHA will pay for their premium for 1 full year up until they're 19 years of age. And we do this not to encourage teenage pregnancies, but to protect teenage mothers, because we know those mothers usually have bad outcomes. And so we're really encouraging the residents of Vihiga, ukiona kuna yule mama ambayo ni mchanga chini ya miaka ya 18, umlete, msajili, SHA itaweza kumlipia premium yake ya mwaka mmoja. Tukiangalia mambo ya malipo katika hii kaunti ya Vihiga, tunaweza sema kuwa kaunti inaendelea vizuri. Mambo ya primary healthcare, county government imepata taslimu 80 million to date, na hiyo inamaanisha kuwa services pale kwa health center na dispensary na level 4 outpatient zinaendelea vyema. Tutaendelea kutia bidii ikifika mambo ya tertiary services, na tunafurahia uongozo wa Gavana Otichilo kwa hii siku ya leo. Kwanza kuhakikisha kuwa wafanyikazi wake, caring for the carers, that they are protected, and now they have a scheme that will enable them to access care. Please listen to your county secretary. There are administrative processes you need to take into place. Register your dependents, ensure your documents are ready so that you can start enjoying this cover. And we are happy and ready to serve you as SHA. Asante.